Hi, everybody. Brianna with Nurse Deck here. We are having another installment of our Insider Perspective Nursing Interview Series. Here at Nurse Deck, we give nurses a place to belong to, a platform to be heard from, but most importantly, the breathing room to be accepted right where you are today. Nurse Deck is built on our collective nurse voice. Today, we're proud to add the voice of Cerinena McLean. Cerinena has an extensive clinical background that covers infectious disease, infusion nursing, cardiology. Currently, she's working as a hospitalist NP, and she is also the founder and CEO of Healing Hands Medical Staffing. Cerinena, welcome, and thank you so much for doing this with us. We really appreciate you giving your time to us.
Thank you for having me.
Yeah. So we're just going to jump right in. We always like to start at the beginning from how you got your start in nursing. This is my favorite question, hands down, because everyone has such different ways that they get into the field. So tell us how you got your start.
So I wish I could say nursing was my first choice, but it wasn't. I always wanted to be a pediatrician. And and so I started after high school. I went to Montclair State University, which is in New Jersey, and I studied biology undergrad with the intention to go to medical school. Mm-hmm. During my studies, unfortunately, my great-grandmother, which I was very close with, she wound up having a stroke, and within a week or so, had a heart attack. Of course, the extended hospitalization stay. She was in ICU for a few weeks. But the care that she received was like unremarkable. The connection of the nurses, their bedside manners, it was like, wow, this is different. This, I never had any experience with the hospital setting. Fortunately, for my family, we were pretty healthy. So that was my first encounter with that type of setting. So that got my mindset. But I did finish my undergrad in biology because I was already far gone. I was already my junior year.
Too far gone.
They don't wait on time.
Yep.
So I finished it out.
Right.
But I was like, I'm not going to be a doctor. I want to be a nurse. That's where it's at. Love they just really changed my trajectory in the viewpoint of it. And so I went to school. Actually, I moved down to Georgia, and I went to nursing school, and the rest is history. And of course, I moved on to becoming a nurse practitioner, just to make sure that just want to be sure that I'm treating the whole person. So I needed to learn a little bit more nursing. So I went to NP school and became a nurse practitioner.
Yeah. Very cool. I love hearing stories like that, especially I didn't intend that. I also come from that same background as well, where I avoided trying to be a nurse and then it just sort of found its way in. So thankfully, tell us more.
Avoid.
Yeah, right. Exactly. Tell us more about your role as a hospitalist. You're part of a moving team of many other members of medical care teams for patients that are in the hospital. Can you tell us what your role is in that?
Okay. So I'm a general hospitalist, meaning I'm not a specialty like a cardiologist or cardiology group or GI group or anything like that. So we do, so just the general medicine. And the best thing about being a hospitalist is you have a team. And I love working with a team and collaborate. As much as we all think we know everything, we really don't. And so working as a team, it just gives us that whole picture so that we're able to treat the patient holistically. So we have our nursing staff, of course, we have our specialty groups, and together we provide the best care for the patient so the patient can have the best outcome. And I think that's the best part of being a hospitalist. Everything. The common cold to, GI issues to, infectious disease issues. And because I have an infectious disease background, that really helps with these different disease processes that I see throughout the day.
Yeah.
But, we do it all. We are a
Yeah.
generalist that kind of know bits and pieces of everything. And
Right.
what's outside of our scope, that's when we get our specialists on board, and we collaborate with them to ensure that the patient is being treated
Yeah.
effectively.
And tell us, for nurses that are considering going into this, what's your day to day like? Do you have like start at 9, end at 9? Is it 12-hour days? What's the schedule like?
Day. But well, as nurses know that it's never really a 12-hour day,
Right,
right?
right.
Basically, I work in a hospital setting, and so my day typically starts at 7 and typically ends around 7:30, 8 o'clock.
Hmm.
And it's, rounding on patients. So you have a caseload.
Yeah.
It could differ from 10 patients to as much as I've had 20 patients, 21 patients during the
Wow.
pandemic.
Yeah.
And so you're rounding on all these patients, you're creating care plans, you're collaborating with different team members, your nurses, your specialists, to make sure the patient is getting what they need each step of the way.
Yeah.
And it's exciting to me to see them, especially if you worked your hours or your 12 days, 7 days in a row, or a few days in a row, you get to see your improvement in your patients.
Right.
And you can say, oh, when you first came,
Yeah.
which is the now on day 3 or 4, you're like, wow, you look so much better.
Yeah.
Like,
That's
and
nice.
so to see that, continuum.
Yeah.
Yeah, typically we round on them throughout the day. We're also doing admissions throughout the
Hmm.
day. So the emergency room, if
Yeah.
they're being admitted, we'll have to create a care plan for them as well. Get
Yeah.
them admitted to the hospital and continue to follow them until they're discharged.
Yeah.
So we have a few pieces in there, and also, of course, we have patients that are going home. So we're
Yeah.
doing discharge planning, whether it's home to their home where they came from, or they're going to rehab, or they're going to another facility if we have to transfer them for, higher care. So
Hmm.
we're constantly moving throughout the day. It's not a
Yeah.
station thing for us. So we always have
Right.
to read what we're doing at the end of your shift.
Right. Absolutely. Great. Thank you. Tell us about your company, the Healing Hands Medical Staffing. I love nurse entrepreneurial stories. Tell us how you got into that, a little bit about your organization, the mission and the vision, anything you want us to know about Healing Hands Medical Staffing.
So the short version, because we could talk about this all day, right? So the short version of Healing Hands, a few years in the making before it was actually established. And so it was to have a staffing agency that is full of nurses that's running. Had this experience with agencies, but it's usually just a recruiter,
Mm-hmm.
sometimes not familiar what we need for us
Mm-hmm.
to do our. It's just, okay, let's look at this resume. Oh, you're a nurse. Wonderful. You have your license. You have the job.
Right.
But, but not knowing all the other things that goes behind that. So I said, okay, let's just create a business where I know how to be a nurse because I am a nurse. And let's find the best nurses, put them together so that we
Mm-hmm.
can a healthier community, right?
Yeah.
Having best nurses together, best nursing practices. That's
Yeah.
how we get our patients the best
Yeah.
care.
The dream team.
Yep, there you go, the A team.
Yep.
Yes. And so I find that nurses relate a little better to me because I understand them. I know exactly what they're looking for.
Yeah.
And they don't necessarily have to spell it out for me.
Right. Right.
So when I do match them, it's like, oh my God, Cerinena, this is what I've been looking for. I'm like, yeah, I know.
Yeah.
I get it.
Yeah.
It works both ways for employers. It takes the stress from the employer to having to come back and say, okay, this is not what I want. This doesn't meet my criteria.
Mhm.
Need someone else. Once
Mhm.
I screen my nurses, it's almost a guaranteed fit.
Mhm. Mhm.
Employer and also for the candidate, because it has to be
Yeah.
like a good match, right?
Right. Yeah.
It has to fit like a perfect
Like
puzzle.
eHarmony for employers and employees.
Exactly. It has to
It's
be.
such a good idea, though. I mean, it's you're right because just thinking about it, most agencies, I just assume the person I'm talking to initially is not a medical person. They're just a staffing like connector. But yeah, how much better would that be if you really were speaking with someone who speaks the same language as you?
Mhm.
That's a great idea.
Absolutely. Absolutely.
Yeah,
I've gotten from the feedback that I've gotten from my candidates, it makes them feel so much at ease. Like somebody
yeah,
understands me. They
yeah,
get it,
yeah.
and I think that's a part of our success. We get it. We totally
Hmm.
understand. And we were able to
Yeah.
negotiate that because we understand the worth of a nurse. We
Hmm.
understand the work you. We understand that it's not a easy job at
Hmm.
all. It's
Right.
a lot of work mentally, physically, and so we're able to convey that to the employers. And
Yeah.
so again, make it that perfect fit. And so
Yeah.
we came up
That's
with
very
healing
cool.
staffing, and the rest is history.
How long have you been up and running with that?
We're in our second year.
Wow. Amazing. And what a good time. I mean, COVID brought a lot of terrible, horrible, still is bringing a lot of terrible, horrible to us. But staffing is
Mhm.
one thing. And just the use of agencies to place nurses. I mean, it's like off to the races with that. So I think, you're coming in at a time where your services are so needed, which is like in the world of business, like, yes, Um, so how has that been? Tell us about your experience, because I know we hear about not only staffing and like staffing shortages, but also with like traveler nurses and about, how they wanted to cap their pay and that missing the mark completely. Can you speak a little bit about that, about being in the business you're in during these times?
So good and bad.
Yeah.
It's great because the pandemic, we need you, we need you, we need you. But at times we have just that wants to get $100 an hour, to give vaccines.
Mhm. Yeah.
And it's like, well, let's just kind of be realistic. We understand the pandemic. We understand that you're needed. You're always needed. But realistic as well.
Yeah.
But you're still pretty when the market has shifted.
Hmm.
So we have those employers that do not want to increase their pay. And so, of
Yeah.
course, we're trying to fill those positions, but it's hard to fill because
Yeah.
of the pay. Why,
Right.
$30 an hour and 8 hours a day go elsewhere and get paid $70 an hour for
Right.
half your shift,
Yeah.
for doing something less strenuous on your body,
Yeah. Right.
so in either category, or sometimes we were just in the middle. So we
Mhm.
have to get real creative
Yeah.
and try
Right.
exactly try to find a
Yeah.
market, but understand the market. So
Right.
now the market, like, hey, what's happening in your market? If you want this position filled, we have to change the way we're thinking about this a little bit.
Right.
Say
Yeah.
to my candidate, let's be realistic here.
Right.
Pre-pandemic, you were only making $25 an hour. For you to say you want $100 to do the same job,
Right.
no, we got to kind of find that medium. And so
Yeah.
that's a challenge for us.
Right, exactly.
That's to understand.
And you're staffing people that are local, like more local appointments?
So we're in Georgia, Kentucky, and Tennessee. So I'm
Okay.
in 3 states
Gotcha.
currently.
Yeah,
Hmm.
that's awesome.
Of course, each job market is different per state.
Right. I bet. Especially like the past year. I mean, even month to month, I bet some places, are lighting up as a hot spot, whereas others are cooling down. And yeah, you have such a unique perspective as being the middleman between the two. I'm sure it gets stressful. Um,
It
to
can.
negotiate on both, like you said, the realism
Yeah.
and back down to earth. But it's hard when you're reading in the news, nurses are making like travel nurses, but yeah,
Mhm.
it's
But it
definitely
depends on who you are. It's not across the board, you know.
exactly.
But I'm in Georgia, and Georgia's one of the lower paying states.
Yeah,
So,
yeah, I'm in Florida, so we have the same situation.
and Florida's a little higher than Georgia, believe it or not.
Yeah,
Um, Depends on where you are, and I don't think our candidates understand that until I really break it down. And I'm like,
right.
okay, this is
Yeah,
where we are. And you're
yeah,
like, "Ooh." If you
yeah,
but where you are right now, we just can't meet you there. We just have
right,
to kind of get you higher pay for where you are, where your
right.
location is.
Yeah. Do people come in seeking, like, not so concerned about the pay, but just about the atmosphere of the job? I mean, if they're in like a super high stress place where they're just feeling like they're getting super burnt out, did they come to you for that reason of looking for new placement, or is it usually just about the higher paycheck?
So I'm going to be really honest with you. During a pandemic, I'm getting mostly about the pay.
Yeah,
A lot of is they're underpaid or not
sure.
satisfied with their pay. So they're like, this is the time for me to,
Yeah.
some money and try to save and do whatever it is they want to do with their finances. So we do have a lot
Hmm.
of are coming to us for that reason. That's why they're leaving their
Sure.
9 to 5 and wanting
Yeah, of
to try
course.
to do something else.
Yeah.
But I still have those nurses, usually my older nurses that have been a nurse for a while. It's like, I need a slower pace.
Yeah.
This is the fit for me.
Yeah.
And so, yeah, so we still do have those candidates as well.
Yeah. That's awesome. Tell us your thoughts on just staffing in general. I mean, there's been so many little grassroots movements that are popping up, like the safe staffing saves lives and those types of things. What do you think are some things that we can do to move in the right direction to alleviate staffing shortages?
I think the biggest thing or the biggest reason we're having such shortage is burnout,
Mhm.
to be quite honest with you. And I think if these bigger companies, hospitals in particular, compensate the nurses well or better,
Mhm.
maybe healthcare coverage, better healthcare coverage, and things like that, I think
Yeah.
nurses be more prone to stay long.
Mhm.
Also, we have gone so far from what I call team nursing. Is all about there's your patient, figure out the post when I start.
Right.
Was each nurse was working together for every patient on the unit. So if you were at lunch, I would cover,
Right.
patient. Even if you were just busy and I saw that you were running around, I would cover your patients. And I
Yeah.
think that helps throughout the day instead of having one nurse that has, high acuity of patients around all day and try to help the nurse. So all can get out in a reasonable time or so
Yeah.
we all can a good flowing day so we're
Yeah.
not burnt 7 p.m. So I think more team nursing it will be
Mhm.
a good better incentives, better pay would also help in also adjusting the acuities on the floors. And I can see
Yeah.
that being a professor. Sometimes I see my one nurse with all my high acuity patients. I'm like, oh my
Right.
goodness, we need
Yeah.
to. divvy this up a little bit, because,
Right.
that really take a toll on you, especially if you're coming back the next day and we
Yeah,
like to have that
exactly.
care and you have the
Right.
same patient again.
Yeah.
That's a lot. So we need to,
Yeah.
figure out how to do that on the units to
hmm
ensure that we're sharing the love.
Yeah.
That
Exactly.
one nurse have the high acuity patients. And I also think that would help with
Yeah.
nurses being out.
Yeah. A lot of the conversations I've had with like nursing leaders from so many different backgrounds, we talk about nurse leadership and how really in nursing school you're not prepared, to manage people or to be in these nurse leadership roles unless you're maybe going to school for it, on the side.
Right.
But it's like after 4 months, you've been here long enough. Now you're the charge nurse. But you're right. You get faced with these puzzles that you have to solve that maybe being on the spot, not really orienting as a charge nurse officially,
Mm-hmm.
trying to assign different acuities, like you said, but those decisions impact your nurses so
Absolutely.
much. So we really need more, I think. I don't know if nursing school is like the most appropriate place for it, but just some more leadership training for nurses, and leadership and management training, I think would help there. But that's such a good point that you brought up about that little things like that. I mean, that one nurse can be exhausted working on the same unit as another nurse who just didn't have a similar patient load that week.
Right.
Um, that's a great point. Um,
Mm-hmm.
you yourself, looking at your CV, you have overlapped a lot of your roles. How have you avoided getting burnt out doing all of this? Have you avoided being burnt out?
I think, and I hate to say, but I think I'm just used to being always busy.
Yeah.
I've always had multiple jobs. I just like, but for me, I have three things that I live by. The order of my life is God, family, career, and everything else after.
Yeah.
To my body. So if I feel like something right, my energy, something is wrong, right? And so that's when I take a step back and I self-examine. What is going wrong? What has changed? Did I add something new? Something is going on. We got to figure this out.
Yeah.
And I usually take that time, I pray, and figure out what that something is. Once I identify it, depending on what it is either I can resolve it, or if
hmm
it's something that I can solve, maybe I need to delegate that. Or if it's related, or maybe something I just need to say, you know what, God, you take it. You take control because I can't figure this out. I can't do anything
Yeah.
about it. And so that in turn alleviate my inside of that's my best reliever. Being with my
Yeah.
children, being with my family to keep me grounded, and that's the best way for me to relieve my stress.
Yeah.
Um, and so, a lot of family time is what
hmm
I try to incorporate in my life.
Yeah.
We still have a tradition with my family as we have the siblings. We still we still have Sunday dinners with my parents every
Yeah.
Sunday,
Love that.
single Sunday. So we have my nieces and nephews, my siblings, my mom, my dad, of
hmm
course, my husband, and we all share quality time. How was your week? How's things going? What you worried about? We talk about things. We talk
Yeah.
through things. That definitely helps with my stress,
Yeah.
and that definitely keep me going, keep me motivated,
hmm
keep me. And that's what I rely on: God and family
Yeah.
mostly.
I like that. I feel like you have a strong mantra, and that's such a better approach than I think a lot of nurses that are like, I know I need to be doing this self-care thing, so I'm just gonna throw a bunch of stuff on the wall and see what sticks. But I love how
You
you start up.
For
Yeah,
sure. For sure,
yeah,
you need to take a break. For sure, you need self care. But yeah, just in the order of how you do things, because
yeah,
sometimes you have to clear your mind first before you
yeah,
can take care of it.
right.
You say you throw
But I
things out
like how
there.
you kind of nursing. Yeah, I like how you did the nursing process towards it. Like identify the problem. What are my interventions? Did they work?
Right.
That's
It's the
awesome.
process.
Nurses that are feeling burnt out right now, we have so many. It's such a big topic on our social channels. Um, how do you think they can help to boost their own morale, keep themselves going? Um, do you have any tips or life advice?
I think they need to know and understand that what they're doing is very important, that they are needed, even though the patients or the patient's family may not show
Yeah.
the appreciation at times. The community
Mhm.
appreciates it, and you're well appreciated.
Yeah.
And you just need to understand that if you need time, it's okay, and it's
Mhm.
okay to be okay. You
Yeah.
know, it is something where you're burnt out, it's okay to talk to someone,
Mhm. Yeah.
especially during this pandemic. So many
Yeah.
of us experience so many levels personally. Emotionally. It's okay not to be okay. And we have stigma, whereas, I'm a nurse, I'm supposed to take care of everyone, and, I'm supposed to put my best foot forward. That's
Mhm.
fine. But when you're not okay, you need to make sure you are. There's
Right.
no way to take care of anyone else if you're not well, physically
Yeah.
and mentally. You have to be
Absolutely.
well here for other people.
Yeah. That's
So,
100% true.
that, whether it's that you need to take time off, take a little vacation, whether
Mhm.
whether you need to speak with someone like a psychologist, a psychiatrist, or
Mhm.
family, whatever,
Mhm.
you take that time for you. And like we
Mhm.
just mentioned, self-care, whether you
Yeah.
need a massage every 2 weeks, like myself, and just like to treat yourself to a good restaurant,
Yeah.
shopping, whatever it is that makes you
Right.
happy, take that time for
Yeah.
yourself.
Yeah.
Very important. And just to avoid that burnout, because once you get burnt out, few things happen. You never really get out of the way to really care for your patients. Okay.
Mhm.
You to have this I don't care attitude. I'm just going for a patient,
Right. Right.
which to me in my book is a big no-no.
Mhm.
Um, here because we love what we do, because we're caring, we're compassionate.
Yeah.
Um, so once you get to that point, it's time for a new career, I think.
Mhm. Yeah.
Um,
That's
and
very
then
true.
you're burnt out there, you're not really focused, you're not paying attention.
Yeah.
And we have to remember that we're dealing with people's lives,
Yeah.
literally.
Right.
Literally, their lives are in our hands. And so we have to always be on point. We always have to have our A game when we show up. And we have to
Right.
just believe in it at or
Yeah.
to keep those perspective when we're down.
Yeah. No, that's
Uh,
I think you bring up such a good point. It it reminded me of a story, and I'm trying to remember the woman's name, but I've seen it circulating around. It's a nurse that's being criminally charged for a medication error, as opposed to just her license being taken away. Did you see that too? Or she had like pulled out a different paralytic. It was supposed to be Versed, and then she pulled out something else, and her patient died because of it. And this was,
and
5 years ago, but the way that the state is bringing up the case, they're prosecuting her, which I just feel like every nurse around the country is like, it's my worst nightmare. Already living with a patient death on your hands, and then on top of it, just the punitive, criminal action against her. So I think when we talk about burnout, we talk about the damage it does to yourself, but also you're right. You can't do your job when you're burnt out. It's just
mhm,
something like this could happen, and oh, my heart goes out to her and the family of that patient. But my gosh, that's just the worst
yeah,
case scenario on all accounts.
absolutely.
Um,
These are that are damaged on both ends, right? The
yeah,
nurse and the family. Yeah.
absolutely. Since the COVID-19 pandemic, which is going on for so long, um, changes to healthcare. I mean, there's so many things that COVID has shown a light on. The cracks in the system got bigger. Some long-standing things that are just wrong with healthcare access in our country. What are some of the biggest changes you hope to see come out of the pandemic?
I think the biggest thing that I hope stays after the pandemic is telemedicine.
Yeah.
I think so beneficial
Yep.
to
I agree.
our elderly, and not only our elderly, but those that do not have access,
Yes.
right? Whether it's transportation or whether it's finances, whatever
Yep.
the issue may be,
Yeah.
um, you can always see a provider.
Mm-hmm.
There's a doctor or a mid-level nurse practitioner or PA. And to me, I think that's really important because now they won't be out of their medicines, because most
Right.
providers won't rewrite your prescription if you
Right.
haven't seen an amount of months, right?
Exactly.
So if you have no access, whether it's transportation or finances to get to the office, now you're without medicine. So now you have exacerbation of common diseases such as
Right.
COPD, PHF, or hypertension and things like that. So if this continues to be in place, which I think it will be, I think that
Yeah.
will help so many people around the world, so
Yes.
many people, communities, to ensure that their health is still being taken care of, to ensure
Yeah.
that and in turn keeps them out of the hospital so
Right.
they're not ill. And
Right.
so, yeah, so that these hospital beds for those who are critically ill.
Right.
Okay. And that's one thing I really, really do hope that, healthcare will just go in that direction. Not
Yeah.
to say to take away the brick and mortar, those, doctor's offices.
Sure.
I'm not saying that. But for those who need it, I think that
Yeah.
will be really beneficial.
Yep.
Um, Also, as elementary as it may seem, COVID has made us be more conscious of hand washing
Mm-hmm. Yeah.
and covering
You're so
our
right.
mouth.
You're so right. Yep.
As it may seem, I
Mm-hmm.
hope we do that as well and continue
Yep.
to, speak about it and to encourage
Yeah.
and to remind people about it. Last
Yep.
year, being in the hospital, we had maybe a handful of flu
Mm-hmm.
diagnosis. Why is
Yep.
that? Not that it wasn't flu around, but
Sure.
we're
Yes.
all in our face when we cough and sneeze because nobody wants to
Yeah.
COVID.
Right.
Um,
Right.
so
That's, you know what? That's such a good answer because it seems so simple, but it's often those little simple things that people are just overlook, or
we
everybody always overestimates how well they do with it. If you really look back, did you really
Mhm.
wash for 20 seconds? I don't know. Yeah. I
Probably
remember
not.
reading that in the beginning about like hospital acquired infection rates had gone way down. And I was like,
Mhm. I was say that you took the part right on my head. I was just about to
yeah,
say that. So not only in your day life, but also in your medical community, it will
yes.
really it will
Yeah.
keep those diseases down while hospital acquired diseases. It'll definitely help.
Yep.
So those are the things that I hope really really stays, and
Yeah.
we just make our community a healthier community all in all.
Yeah, I love that. Both those answers are right on the money. Lastly, I'd love to talk about community and the feeling of community within, nurse tech and just nurses at large. I think we get so isolated, especially just physically with all the amount of PPE that people were wearing at work. I think that's, gotten a little bit less so. But that was a theme we would hear more and more and more on our sites, was just about nurses feeling very alone, even if they're surrounded by their workmates all day. Um, but the value of community, that's like our big thing at Nurse Tech. Tell us your thoughts on community, how you think nurses can benefit from being a part of any type of community, ours or any official organizations or just friend groups or what have you, or if you have any insights into that as well.
I think I think it's just human nature to want to belong.
Yeah.
to whatever that community may be, nursing or otherwise. And so it's really important. And I also think it builds morale. I also think it builds confidence, for someone to belong to a particular community. As far as the nursing community, we are large. And I love that because there's so many of nursing that, if you can't relate to, let's say, a hospitalist, or if you can't relate to cardiology or GI, there's so many
Right.
different nursing community that you can always feel like you have someone to talk to, someone that understands you, someone that you can relate with. Because while I may not be able to relate to someone that works in surgery, for example, I'm sure I find someone works in cardiology because I've done that for many years.
Right.
And so it kind of helps you to make you understand that you're not alone.
Yeah.
If you're burned out in that particular area, there's someone else that's experiencing that. And
Right.
so with experience, you're able to share your thoughts, your feelings, you're able to learn from experiences, you're able to overcome
Yeah.
obstacles
Yeah.
that you may be facing in those areas. And, they say it takes a village. And I think that's kind of what these communities uh,
Yeah.
are similar to is that whenever you're down, there's always someone there to uplift you in
Yeah.
whatever area that you're feeling down. And so I think is a great community. As far as Nurse Deck is concerned, I think it's a fantastic platform. It has so many different areas. It's not just, a platform for med surg nurses, for example.
Right.
So it goes back to me having something to so many different people and experiences that you can relate to,
Yeah.
and so many things you can, um,
Right.
so many ways you can expand your knowledge, so many ways you can expand your career. If it's something you're
Mhm.
thinking, you can reach out and say, hey, Brianna, how did you get started?
Right.
What are your thoughts on this?
Hmm.
Um, just having that collaboration between
Yeah.
people.
Yeah. Yeah. I find people are usually more than happy to answer those questions, even as intimidating as it can seem, to be like, can you, give me a little bit of information about how you got from point A to point B? Especially now that nurses, so many of us are looking for greener pastures, or just to be valued somewhere. If we're not feeling that way in our current roles. And
Mm.
so, yeah, I love that you said that there's so many examples around you, and it's just yours for the asking. You get up the courage to ask someone. So, um,
I should,
well, this is awesome. We are rounding up our conversation here. We always like to open it up to our guests and see if there's anything else you wanted to speak about, or if you had any messages for nurses out there that are listening or watching or reading. Um, your words, and we like to leave on that note. And we always put links into. I always like to let everybody know about how they can find you, and find your company as well. But I like to give the floor to you.
I just want to understand, as I mentioned before, that you are valued, that you are in our community, even if no one telling you that you're valued. We you in a one patient at a time, and just show up and show out each time you go to work.
Yeah.
Because you know what you're doing, skill what you do, and we at some point you should are only going to get older.
Yeah.
On pushing. It's not easy, but don't give up. And nothing that is worth it is easy. Believe me.
Yes.
Keep on pushing. Um, that's what
Yeah.
some
That's great.
that fire going, And I promise you, in the long run, it will definitely make a difference in our community.
Yeah. Awesome. Cerinena McLean, thank you so much for joining us this afternoon.